Good day everyone, I am Dr. Osam Rahim from Mees and Different Radiology. Actually, after previous 4 videos which I talked about MRI introduction, I think all my friends who listen to these videos now, most of you become more familiar with MRI examination. So from now and every Wednesday, I decide to start MRI learning series depending on pathological consideration. Today, my topic is I will talk about the role of T1 weighted image and its best friend fat suppression MRI sequences in amazing diagnosis. Actually, I decide to make these presentations in 3 parts. Today, I will talk in the first part. First part, my best friend is pretty cool. What is this? Let's gonna go through my presentations to know what is meaning. The learning objective for my presentation is what is the meaning of T1 WI, what is the importance of T1 in differential diagnosis, pathological cause of high T1 signal, how can FS fat suppression help in differential diagnosis. I will talk today, and after I will talk my presentations, I presented 5 cases. These 5 cases, all of them are T1 weighted imaging because the subcutaneous fat is bright signal and also fluid appear dark signal like this fourth ventricle CSF or this urinary bladder. All these lesions appeared high signal in T1 like this lesion and also like these 2 lesions in the case 2 and this lesion. Here the lesions appeared dark signal in T1 and this lesion in the sagittal image T1 appeared also high signal. And this is MRI brain axial image which is showing normal T1 due to CSF appeared low signal and subcutaneous fats appeared high signal. So let's start our presentation. To know what is the diagnosis of each case. Definition of T1 weighted image. T1 weighted image, also referred to as a T1 weighted image or spin-lattice relaxation time, as we'll talk in physics before. I have one presentation talking about the physics. If you still confused, you can return to this presentation. Is one of the basic pulse sequence T1 in MRI and demonstrates the difference in the T1 relaxation time of the tissues. A T1 weighted image relies on the longitudinal relaxations of the tissues, net magnetization vector, and the T1 FSA, meaning T1 fast spin echo. This still spin echo. However, T1 FS meaning T1 with fat suppression. So this is spin echo also, but with fat suppressions. However, the fast spin echo is one variant from the spin echo original T1. This is the T1 relaxations as I described before in the physics presentation. And T1 meaning the protons return to the longitudinal magnetizations with the main magnet. And this return is taking time. According to this time, the tissue can be differentiated. Anyone can detect which signal of these MRI sequences representing T1? This one. Why? Because CSF in the perimesencephalic cistern appeared low signal, and also in the aqueduct of Sylvius, this dot appeared low signal. However, the fats in the retroorbital regions and in subcutaneous regions appeared bright. So this is T1. Also, according to the MRI parameters as I described it before, TR, TE, FA, this parameter is representing T1. However, the other sequence like this and these sequences have TI, which is representing inversion time, and this inversion time is meaning these sequences are flare, and this sequence which is showing fluids appeared bright signal and subcutaneous fat is a little bit bright also. So this one and this one is T2. However, the when the outlines is hazy like this sequence and CSF appeared low signal, it representing diffusion wetted image. All these different MRI sequences have the same fat suppression. If we look to subcutaneous fat, it is suppressed in all sequence. However, how can differentiate each one? Look at first for the TI. If there are TI, it representing a flare image. However, if there are no TI like these images, it representing spin echo. So this one is inversion recovery sequence, which is called the stair here, and these two are spin echo T1 or T2 according to the fluid in the image. Here in the urinary bladder appeared bright in T2 and here appeared dark in the T1. Low signal fluid representing the T1 with fat suppression, T2 with fat suppression. Stair image, and this one which is showing the muscle is proton density fat suppression due to the muscles appearing slightly high signal due to it have concentrations of the protons, a lot of concentration of the protons more than the other tissue. The fluids in the proton density image appeared slightly bright like this cyst and this fluid in the urinary bladder to differentiate it from the T1 fat suppression sequence. So this one is proton density fat suppression, stair, T2 fat suppression, T1 fat suppression. All fat suppression sequence with different MRI sequence. Today I will talk about the abnormal high signal in the T1 wetted imaging, which can be seen in the melanin blood-like subacute phase of the blood, methemoglobin, representing methemoglobin, the fat or flow like thrombosis within the veins or the vessels, proteins like colloid cyst, posterior pituitary gland, and paramagnetic substances like copper or manganese, contrast gadoliniums, and cholesterol. All these can cause high signal in T1, and it can be remembered by mnemonic word my best friend is pretty cool. My M from melanin, B from blood, F from fat and flow, B from protein, posterior pituitary gland and paramagnetic substance, and C from the contrast and cholesterol. Now we'll start our 5 cases, which I presented it in the start of this presentation, and how can reach the final diagnosis by helping of the T1 wetted image and its best friend fat suppression sequence. The first case is a 33 years old female patient presented with pelvic discomfort, and this is the T1 wetted image, which is showing the urinary bladder, which have low signal, fluid appeared low signal in the T1, and the subcutaneous fat, which appeared high signal, and there are lesion here, which showing a high signal also. So high signal in the T1, it's similar to mesenteric fat or subcutaneous fat, so representing a fatty lesion. If I presented with high signal T1, I will go to my differential diagnosis, which is called my best friend is pretty cool. Blood, fat, flow, protein, posterior pituitary gland, paramagnetic substance, contrast to cholesterol, and melanin. All these can cause high signal in the T1. So this is a presented case with T1 wetted image, which is showing subcutaneous fats is bright and urinary bladder fluids appeared low signal. So this is T1 fast spin echo sequence, showing focal lesions at the right adnexa, which have high signal in the T1 representing fat. But still I don't confirm is this fat or not. So I will go to the best friend MRI sequence to the T1, which is called the T1 fat suppression sequence. T1 fat suppressions, why? Because subcutaneous fat is dark, suppressed, and also the urinary bladder still have low signal. What about the lesions? The lesions appeared also suppressed fat signal. So this confirm the content of these lesions is fat with another heterogeneous component. If we go to this sequence is showing subcutaneous fat is suppressed, so it is fat suppression. And the urinary bladder showing a little bit contrast, and also the pelvic veins is bright now. So this is post-contrast study of the T1 fat suppression, also showing the lesions which have the same suppressed fat signal with no enhancement. What about this sequence? Actually, the subcutaneous fat appeared dark and the bone appeared bright, so this is not MRI sequence, this is CT sequence. CT sequence confirm the presence of fatty component in that lesion which appear of minus Hounsfield units, as we measure here 145 Hounsfield unit. So this lesion is also confirmed by CT as a fatty lesions, and also in this sagittal view of the CT confirms the presence of fat and other components, soft tissue component within the lesions, which measuring about 100 Hounsfield unit, comparing with this mesenteric fat, which also have minus fat about 100. However, the dark air within the bowels have thousands of Hounsfield units by minus, and this is a different degree of the Hounsfield units between soft tissue and the bones also. So this is CT and this is CT, and this lesion is fatty lesions with no enhancement. What about the signal in the T2? This is T2 spin echo, because the subcutaneous fat is still bright and the urinary bladder have fluids which appeared bright, and the lesions appeared high signal also, or slightly high signal in the T2 weighted image like subcutaneous fat. Similar signal of the subcutaneous fat, so also it is confirm the fatty component of the lesion. However, the sequence of T2 and the T1 was contrast fast spin echo without suppressions have a little bit rule in the diagnosis of this fatty lesion, because it appeared here the urinary bladder is filled with contrast. So this is T1 fast spin, because the fat in subcutaneous region is still bright signal. So the final diagnosis is the right ovarian dermoid cyst, and the main sequence which diagnose it is the T1 and the fat suppression sequence. Second case is 46 years female presented with query hydrosalpinx by ultrasound or fibroids by unenhanced CT. MRI when done, this is a sequence is T1 weighted image, the two subcutaneous fats appeared bright, and there are two lesions are appeared here, which have also high signal like mesenteric fat and subcutaneous fat. So it is representing, maybe it representing fatty lesions in the adnexa in this female. So if I presented by hyperintensity T1 weighted lesions, I should go to the differential diagnosis, which is called my best friend is pretty cool. And this is a mnemonic word to remember: melanin, blood, fat, flow, proteins, posterior pituitary gland, paramagnetic substance, contrast, and cholesterol. However, the most important one is the blood and the fat in this differential diagnosis, which is causing a high signal in the T1. So this is the T1 weighted image fast spin echo, which is showing a high signal lesions in the pelvis in this female. This sequence is the T1 fat suppression, because the subcutaneous fat is suppressed. However, the lesions is not suppressed. So these lesions not containing fat like subcutaneous fat or mesenteric fat, which is suppressed here. So these lesions not containing fats due to T1 fat suppression is not suppressed. What about the post-contrast study, T1 fat suppression, who is post-contrast, showing also no enhancement or no nodules or enhancing component within the lesion. And this is the CT, which is showing these lesions, which lobulated outlines and inseparable from the fundus of the uterus. So it is confused by the CT as a diagnosis of fibroid. What about this sequence? This sequence, subcutaneous fats appeared bright, and the follicles, the normal follicles within the ovary appeared also bright. So this is T2 spin echo sequence. What about the lesions? These two lesions appeared T2 slightly intermediate signal, as we see here or there. So this T2 also, because still the follicles appeared bright. However, the subcutaneous fat appeared suppressed, not like this one T2 spin echo. This is T2 spin echo also, but fat suppression, with fat suppression. What about the lesion? The lesion is still the same intermediate signal in the T2, and this signal, it is called T2 shading sign. So we presented with lesion have high T1 signal, not suppressed, so not containing fats, and have T2 shading sign, and this is helping in diagnosis of endometriomas. Case 3, 54-year female presented with trigeminal neuralgia, and the examination of the brain done to examine the trigeminal nerve. However, there are other incidental findings which is showing a bright signal in this T1 weighted image, because subcutaneous fat is bright and the fluid in the fourth ventricle is dark. So this is T1 weighted image showing a high signal T1 weighted image at that region, para-sphenoid, or within the adjacent sphenoid bone. Anyway, we have hyperintense T1 weighted image. So if we go into the differential diagnosis of high signal in the T1 weighted imaging, my best friend is pretty cool. So this is the T1 weighted image, fast spin echo, showing a high signal lesion in the T1 representing maybe fat. I need the best friend sequence for the T1, which is called fat suppression sequence. This T1 fat suppression with contrast, which is showing a suppression of the bright signal of the in the T1, representing a fatty component, and confirm the presence of fatty component at that region which is adjacent to the sphenoid sinus. T2 weighted image, due to the fluids appeared dark, high signal, and the subcutaneous fat is high signal, showing intermediate to high signal of the lesion. And this sequence is have hazy outline, and the CSF appeared dark. So this is a diffusion weighted image, and at the site of the lesion there are no abnormal high signal. And this sequence, it representing T1 fast spin echo sequence, because the subcutaneous fat is not suppressed, so this is not fat suppression, and with contrast, because the vessels appeared slightly enhancing or opacified. So the lesions appeared also no contrast enhancement in the T1 fast spin echo or T1 fat suppressions post contrast, and the final diagnosis is considered the fatty lesions at the region of the right sphenoid sinus, which is not seen at its place. So the final diagnosis is considered arrested pneumatizations of the right sphenoid sinus. Case 4. Case 4 is 40 years old female patient presented with query post-operative fever, and this is a T1 fast spin echo, because the subcutaneous fats appeared bright and the fluid in the urinary bladder appeared dark, and the uterus is slightly displaced by this heterogeneous low signal in the T1 weighted image. So this is T1 fast spin echo showing low signal lesion, and in the subcutaneous fat suppressed with still urinary bladder is low signal. So this is the T1 fat suppression sequence, which is showing also no change in the signal of the lesion. However, here the subcutaneous fat is bright and the fluid in the urinary bladder is bright. So this is the T2 weighted image. The T2 showing there are cystic lesions in the right ovary, and also there are heterogeneous signals surrounding the ovary, and longitudinal tortuous high signal also posterior to the uterus and inseparable from the right adnexa. And this sequence is T1 fat suppression, because the subcutaneous fat is suppressed, however in the coronal position, and this high signals due to oral contrast administration to the patient. In the coronal T2 wetted image, because the urinary bladder appeared high signal and subcutaneous fat high signal, so showing the cystic lesions in the right ovary, and also there are multiple cysts in both ovaries. As we see, this is the right and this is the left ovary, and this is part from the uterus, which representing polycystic ovary syndrome, and this is incidental finding with this heterogeneity in the right adnexal region and the cystic component lesion. Until now, there are no differential diagnosis clear because there are no high signal in T1, so and the fat suppression is not adding more for this. So without fatty component of the lesion, we can depend on the other sequences like contrast, which can help us in the differential diagnosis of this case, which have presented with postoperative fever and post-contrast showing marginal enhancement of the tubular structure here, and also marginal enhancement in this cystic component and heterogeneous soft tissue enhancement surrounding the area with fat stranding. All these findings are consistent with infections and may be associated with tubo-ovarian pathology, and the tubo-ovarian abscess considered as a diagnosis for this case. Case 5, 36-year female patient presented with query sacroiliitis, and this is the axial image at the pelvic level, which showing subcutaneous fat is bright and the fluid in the urinary bladder appeared dark. So this is the T1 wetted image. We see lesion here. These lesions have high signal in the T1, so it may be fat, and I need the best friend for this T1 wetted image, which is called fat suppression, to confirm the presence of fat or exclude it. Anyway, if I presented with hyperintense T1 wetted image, I go to my best friend is pretty cool as a mnemonic word for differential diagnosis, and I check one from these differential diagnosis according to the other MRI sequences and the patient clinical presentation. Okay, this is the sequences done for that female patient, and the T1 wetted image and the other three sequences are fat suppression sequence. If we look here, there are TI, so this one is the stir image, inversion recovery sequence, and the others is T2 fat suppression and T1 fat suppression, because the fluid within the uterus appeared here slightly high signal. So the lesion is high signal in T1 and suppressed in all fat suppression sequences, so it representing fatty lesions in this young age female is representing ovarian dermoid cyst in the left ovary in that patient as a final diagnosis. To summarize my presentation, if I presented with high signal T1 wetted image, I should consider my best friend is pretty cool in my differential diagnosis for M from melanin, B from blood like subacute methemoglobin. I will make one part from my presentations about this separate, and F from fat, as I talked in these presentations for fatty lesions. F also from flow, if there are arrest of flow in the veins which representing thrombosis, can be appeared high signal in the T1. And B, pretty, is from protein or any proteinaceous materials like mucocele or colloid cyst. Posterior pituitary gland normally have fatty component, so it appeared high signal in the T1 wetted image. And paramagnetic substance like copper or manganese also can cause high signal in the T1. And at the end, C from the contrast. If there are contrast, it enhance or appear the high signal in the T1 like gadolinium. Cholesterol like cholesterol granuloma or cholesterol lesion also appear the high signal in the T1. The second home message should be remembered is the fat suppression is the best friend to T1 in helping it to exclude or confirm the diagnosis of presence of fat within the lesions. Uh, Whatever the fat separation sequence, MRI sequence like this different MRI sequence T1, T2, proton density, or stair image, which depend on the inversion recovery time. That presentation is talking about the first part of the importance of the T1 in diagnosis of the lesion or shrinking the differential diagnosis. Still, I have part 2 and part 3 with me every Wednesday to talk about the learning MRI, and every Sundays for rapid review anatomy, and every Fridays for Arabic presentation. Thank you for your watching and have a nice day.